Hello and welcome everyone. Today we are discussing about rapid car tests. They includes malaria, filaria, dengue, typhoid, chikungunya, HIV, hbsag, anti-HCV, syphilis, pregnancy and COVID rapid antigen and antibody kits. The principle of rapid car test is almost similar for all the tests, which is following. This is the sample pad and this is the absorbent pad. On the sample pad there is a mobile phase. It contains colloidal gold conjugate specific antibodies against antigen to be detected. Absorbent pad include immobile phase of monoclonal specific antibodies against antigens to be detected. And the second line, which is control line, it contains immobilized IgG to specific antibodies. So when the sample containing antigen is added on the sample pad, the antigen attaches to colloidal gold conjugate specific antibodies. This travels through absorbent pad via capillary mechanism. So this colloidal gold conjugated specific antibodies with antigen binds to immobilized part of monoclonal specific antibodies, and only colloidal gold conjugated specific antibodies binds to IgG to specific antibodies. These bindings generate test line and control line. In the positive result, you can find test line and control line both. In negative result, you will find only control line, and in invalid results, there are no control line or only test line is there. Malaria antigen. The immunochromatographic dipsticks are easy, rapid, non-microscopic methods for malaria diagnosis, and they save training and time. Malaria antigens currently targeted by rapid detection kits are HRP2, PLDH, and Plasmodium aldolase. HRP2 is a water-soluble protein produced by asexual stages and young gametocyte of P. falciparum. It is expressed on RBC membrane surface, and because of its abundance in the P. falciparum, it was the first antigen to be used to develop an RDT for its detection. PLDH is an enzyme found in glycolytic pathway of malarial parasite. It is produced by sexual and asexual stages of parasite. Different isomers of PLDH for each of the 4 Plasmodium species infecting humans exist. The monoclonal antibodies produced against Plasmodium aldolase are pan-specific in their reaction and have been used in combination test with HRP2 to detect P. vivax as well as P. falciparum in a blood. RDT can detect if more than 100 parasites are present in per microliter of blood. HRP2 has been shown to persist and is detectable after the clinical symptoms of malaria have disappeared and the parasite have apparently been cleared from the host. The recommended method and current gold standard used for routine laboratory diagnosis of malaria is microscopic examination of the stained thin and thick blood films, particularly with the additional sensitivity offered by examination of thick blood film. The limitations of this RDT is following. The sensitivity for RDT remains a problem. A negative RDT cannot at present be accepted at a face value that will need to be confirmed by microscopic examination. A positive RDT does not always correlates with presence of parasite in the blood. After the clearance of parasite from blood, still it can show positive result on RDT. Filaria antigen. The test strip is an in vitro immunochromatographic assay for qualitative detection of Wuchereria bancrofti or Loa Loa antigen according to the kit in the human capillary whole blood samples collected during the night time by finger prick. It is recommended that negative test result be confirmed by standard diagnostic methods such as thick smear microscopy, membrane filtration, and another antigen detection method. Analytical sensitivity of rapid test is around 4 ng per ml. Dengue. The rapid tests detect NS1 antigen, that is non-structural protein of dengue, and IgM and IgG antibodies of dengue. In the first 1 to 5 days, NS1 will be positive, and after 7 days, NS1 should be negative. So it is not recommended to do a test of NS1 after 7 days. After 3 days, mostly IgM becomes positive. And if you find only IgG band, then it shows the past infection. The secondary dengue causes more severe disease than the primary. It is important to differentiate between the two. The limitations of this rapid card is negative test results are not confirmatory, and confirmation can be done by virus detection by molecular method. This table shows positivity of NS1, IgG and IgM antibodies and its interpretation. First is only NS1 is positive and both antibodies are negative, then it represents the primary acute infection. Second scenario is NS1 and IgM is positive but IgG is negative, it represents the primary acute infection. Again, if NS1 is negative, only IgM is positive and IgG is negative, then it also suggests primary acute infection. If all three are positive, NS1, IgM and IgG, then it suggests secondary acute infection. NS1 and IgG is positive and IgM is negative, then also it suggests secondary acute infection. If NS1 is negative and IgM and IgG both are positive, then we have to see the ratio of positivity. If IgG/IgM is less than 1.1, then it suggests primary acute infection, and if IgG/IgM is more than 1.1, then it suggests secondary acute infection. If only IgG is positive, then it suggests past infection with dengue virus. Chikungunya rapid test. It is limited to qualitative detection of IgG or IgM antibodies in human serum or plasma or whole blood. The intensity of the test band does not have a linear correlation with antibody titer. The limitation is the negative result for an individual subject indicates the absence of detectable antibodies. However, the negative result does not preclude the possibility of exposure to or infection with chikungunya virus. Some specimen containing unusually high titer of heterophil antibodies or rheumatoid factor may affect the expected results. Typhoid. Typhi IgM and IgG card is a rapid, solid phase immunochromatographic test for the qualitative, differential and simultaneous detection of Salmonella typhi, IgM and IgG antibodies in human serum or plasma. The test is simple, easy to use, and a result will be achieved within 20 minutes. A negative result for an individual indicates the absence of detectable anti-Salmonella antibodies. However, a negative test result does not preclude the possibility of exposure to Salmonella typhi. A negative result can occur if quantity of antibodies present in the specimen is below the detection limit of the assay, or antibodies that are detected are not present during the stage of disease in which a sample is collected. Thus, some specimen containing unusual high titer of heterophil antibodies and rheumatoid factor may affect the results. HIV. There are two types of rapid HIV tests available. One detects only antibodies and second detects antibody with P24 antigen, which is called the fourth generation rapid card test. It is a simple and quick method. This tri-dot test detects HIV 1 and 2 antibodies IgM, IgG and IgA in human serum and plasma. P24 antigen shows cross-reactivity to heterophil antibodies, RA factor, etc. Some sample shows cross-reactivity for HIV antibodies. Following factors are found to cause false positive HIV antibody test results. They are naturally occurring antibodies, passive immunization, leprosy, renal disorders, tuberculosis, Mycobacterium avium, herpes simplex, hypergammaglobulinemia, malignant neoplasm, rheumatoid arthritis, tetanus vaccination, autoimmune diseases, blood transfusion, multiple myeloma, hemophilia, heat-treated specimens, lipemic serum, anti-nuclear antibodies, T-cell leukocyte antigen antibodies, Epstein-Barr virus, HLA antibodies, and other retroviruses. This is only a screening test, and all samples detected reactive must be confirmed by using HIV Western blot and or PCR. hbsag. This is only a screening test for hepatitis B virus. All reactive samples should be confirmed by confirmatory test. False positive result can be obtained due to presence of rheumatoid factor, patients with autoimmune diseases, liver problems, renal disorders, and antenatal samples. Anti-HCV. The fourth generation HCV tridot detects anti-HCV in human serum or plasma and is only a screening test. All reactive samples should be confirmed by supplemental assay like RIBA. Non-reactive result does not exclude the possibility of exposure to or infection with HCV. The patient with autoimmune liver disease, renal disorders, and antenatal samples may show false reactive results. Rapid card for syphilis antibodies. The detection of Treponema pallidum antibodies in the serum or plasma, which are IgA and IgM. The syphilis strip test will only indicate the presence of TP antibodies in the specimen and should not be used as a sole criteria for diagnosis of Treponema pallidum infection. All positive samples must undergo confirmatory test. Pregnancy. The card detects HCG. The detection level is 25 milli-international unit per ml. It cannot detect the presence of HCG fragments or free subunits. The ectopic pregnancy cannot be distinguished from the normal pregnancy by HCG measurement alone. The test result should be confirmed using quantitative HCG assay prior to performance of any critical medical procedure. Interfering substances may falsely depress or falsely elevate the results. It can be positive in trophoblastic or non-trophoblastic neoplasms, HCG-like substances. In the presence of weakly positive result, it is good laboratory practice to sample and test again after 48 hours. COVID antigen card test is designed for in vitro qualitative detection of COVID-19 antigen in human nasopharyngeal and nasal swab specimens. Potentially interfering substances like nasal spray, nasal drop, homeopathic allergic release medicines, anti-inflammatory medicines, antiviral drugs, biotin, etc. may lead to false positive results. This is only a screening test and should not be used as a sole criteria for diagnosis of COVID-19 infection. A negative result may occur if concentration of antigen in the specimen is below the detection limit of the test, or if the specimen was collected and transported improperly. Therefore, a negative test result does not eliminate the possibility of SARS-CoV-2 infection, and it should be confirmed by RT-PCR. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.